and welcome back to the AQA GCSE History, Britain, Health and the People revision series. This is episode 13 and we're looking at antiseptics. Anaesthetics had solved the problem of pain, but surgeons were still faced with high death rates from operations due to the amount of infection. Antiseptics and later aseptics help prevent this by killing germs. There are two main types of approaches for reducing infections during an operation. Antiseptic methods are used to kill germs that get near surgical wounds, whereas aseptic surgical methods aim to stop any germs getting near the wound. Ignace Semmelweis shows that doctors could reduce the spread of infection by washing their hands with chloride of lime solution between patients, but it was very unpleasant, so wasn't widely used. Joseph Lister had seen carbolic sprays used in sewage works to mask the smell. He used it inside an operating theatre in the early 1860s and saw reductions in the infection levels. Lister heard about germ theory in 1865. He realised that germs could be in the air, on surgical instruments and on people's hands. He started using carbolic spray on instruments and bandages. The use of antiseptics immediately reduced death rates from as high as 50% between 1864 and 66 to around 15% between 1867 and 70. However, Lister still faced opposition. Many didn't like the idea of carbolic spray, and it was unpleasant on their skin and to breathe in. In 1877, Lister used a well-publicised operation at King's College Hospital to promote the use of his carbolic spray. This meant the number of operations increased to be 10 times higher in 1912 than in 1867. Since the late 1800s, surgeons have changed their approach from killing germs to maintain an aseptic environment. Aseptic surgery reduces the need for carbolic spray. Instruments are carefully sterilised before their use, usually with high temperatures of around 120 degrees Celsius. Theatre staff sterilise their hands before entering. They wear masks, sterilised gowns, and gloves and hats. Surgical gloves were invented by William Halsted in 1889. So that's the end of episode 13 of the AQA GCSE History, Britain, Health and the People revision series. Next episode we'll be looking at public health. Thank you for watching and I hope you enjoyed.